So today we'll talk about speech disorders. This part of the neurological examination, it frightens many physicians. Assessment starts while taking the history, continues throughout the process of physical examination, and then it is analyzed in more detail by use of specific tests. Now, these speech defects, they fall into four main types. Okay, let's draw them. They are called aphasia, Dysarthria, dysphonia, and also dysphonia is sometimes called aphonia, and mutism. So before we start to analyze these four in any details, what we have to do is we have to make sure if we can place any speech disorder in any four of these groups. First we have to know in which group the speech disorder we are dealing with falls. So how to differentiate? So let's start with mutism first. This is the easiest one to detect. So the patient, in a mute patient, will be conscious, but he will not try to make any attempt to speak. It is usually psychological. It's a psychological disorder usually. Now, it may be seen in different lesions affecting the anterior part of the walls of the third ventricle and the posterior medial surface of the frontal lobe bilaterally. Total mutism is sometimes due to profound motor aphasia, which is also called Broca's aphasia. But then the patient will give impression of both paying attention and trying to communicate, but he will not be able to do it verbally. So this is one is simple. Patient will be conscious and he will not try to make any attempt to speak. This is psychological disorder, sometimes due to bilateral frontal lobe problems, and the problems may be in the anterior part of the pulse of the third ventricle. Bilateral frontal lobe and anterior parts of walls of third ventricles. Alright, now the patient is speaking, but he fails to produce any volume of sound, or maybe he just whispers. This will be called aphonia or maybe dysphonia. Now this is due to disorders of the larynx or vocal cords. So we find a patient like this, he's speaking but he fails to produce any volume of sound and he's just whispering. So what do? We ask the patient to cough. If he can cough, then we must look for a non-organic, that is psychological origin. So in simple terms, an aphonia patient will not be able to cough like normal people, like we people do. Alright, now the third one. The volume of sound and the content of speech are normal, but the articulation and enunciation of the individual words and phrases are distorted. This will be called as dysarthria. that is the problem in articulation, arthria. Now the disorder is of control of the muscles producing speech. The lesion can lie in many different levels. It can be in, you can say, it can be an human lesion, it can be an element lesion, it can be in cerebellar system. So lesion can be widespread. That is why dysarthria is also again divided in 4 types: spastic, hypokinetic, ataxic, flaccid. We'll talk about all these different types in another video. And now let's finish with aphasia. So here what will happen is the patient will fail to put into properly constructed words or phrases the thoughts he wishes to express. He is trying to express something, but he will not be able to put it in properly constructed words. The articulation may be adequate, but then also it will be aphasia. The lesion is one of the highest mechanisms of speech and must be in the dominant cerebral hemisphere. Okay, so aphasic states, they also include disturbances of writing. What do we call them? We call them dyslexia. Sorry, we call them dysgraphia. And if they fail to comprehend the spoken word, we call this receptive aphasia. And if they cannot comprehend the written words, then we call them dyslexia. Alright, so what is aphasia? Aphasia is if the patient is failing to put into properly constructed words or phrases the thoughts he wishes to express, even if articulation is adequate, then it is called aphasia. Okay, the aphasic states, they include disturbances of writing, they are called dysgraphia. Failure to comprehend the spoken words, they are called receptive aphasia. And failure to comprehend the written words, they are called dyslexia. Okay, thank you, and later we will talk about in details. Okay, today let it be only this much.